Good evening, dear viewers. Of course, we're back after this report. So our topic today is on body dysmorphia, or BDD, which is a mental health issue that is often misunderstood and rarely discussed. That's largely due to cultures that are filled with selfies on social media and a barrage of products designed to improve our appearance. Usually, worries about our bodily flaws are often brushed aside or not even taken seriously. We're going to be discussing BDD and the thin line between it and natural insecurities that we can have as humans with the Doctor of Psychiatry, Dr. Abdullah Habib, Director of Clinical Neuropsychology, Mindwell. Good evening, Doctor.
Hello, how are you, Rita?
Great, thank you. It's a pleasure to have you with us this evening, especially that we're going to be talking about an issue that we see a lot, especially when it comes to the younger generations.
Yes.
So to start off, what is body dysmorphia exactly?
So body dysmorphia, or body dysmorphic disorder, is a mental health condition where a person is preoccupied or focuses on a specific flaw in their body. And the problem is this flaw normally is so small or unnoticeable to most people.
Yes.
But to them, it's drastic, it's huge, and they see it way bigger than what people tend to see.
All they see.
Yeah, and that's what they tend to focus on. And if they even tell someone, well, do you see this part of my body, or do you see this thing? They would tend to tell them, I don't know what you're talking about, I can't see it. So this is a very problematic way of thinking, because we tend to spend a lot of our day, or the person that has it tends to spend a lot of their day focusing on that. So we tend to see body dysmorphic disorder in all ages, but it focuses mostly on teens and adolescents. That's what we see it the most, so prior to the age of 18. Men and women tend to get it, but when we look into the research and we look into the general population, there's a slight skew toward more women having it than men. But this is always depends, like as always, on research and where it's conducted. This plays a big part on the statistics in the US is different than the statistics in Europe, in Australia, in the Arab countries is different. But when we see the overall, we tend to see women tend to have it more than men. But if we look into specifically what kind of symptoms we're looking at, you would tend to see a person that focuses on a specific body part and are obsessing about it not being well. You tend to see them either spending a lot of time on seeing themselves in the mirrors, or sometimes even avoiding mirrors completely. They don't want to see it.
Right, and I've seen that.
Yeah, they don't want to see themselves because that highlights it. Another aspect is you see them comparing themselves to other people. It's like, well, my features are this way. How is it that they're different from this other person?
Yes.
And again, with all of these, they tend to fixate on that one specific flaw that to them is a very strong flaw.
Right. Dr. Abdullah, all of us do have these insecurities, and all of us have this one thing that we only see in ourselves that maybe other people don't find an issue, and that's where the mirror comes in. But when does the concern with our appearance actually become BDD? Where's this thin line?
Yeah. So, as you said, we all have these insecurities about a certain body aspect of ours, or something that we think is a little bit, could be off or could be improved on.
Right.
And this is normal. And this insecurity is, as long as it's not an impairing one, then it's fine. So when we tend to see it becoming a condition or something we should be worried about is how long, and I think this plays in a lot of even the episodes you spoke about before, is the intensity of the condition, how frequent it is, and how much of our day does it take, and does it impair my everyday functioning. So if you, for example, are someone that is spending hours on the mirror, focusing on that, or spending hours choosing clothing that makes you look in a certain way, or spending hours trying to, for example, brush your hair in a certain way to cover certain areas, because maybe, let's say, you're balding or you're losing hair.
Yes.
If you're spending hours and that's all you focus on, and then you move to not being able to do your everyday functioning because your mind and your thought is focused on that, this is when we see it as becoming more problematic. But if it's the average unhappiness with certain body parts or the way we look, this tends to be normal, and we shouldn't be confusing it with, okay, you have body dysmorphic disorder. And I think the biggest aspect is people with body dysmorphic disorder, when they come to raise an issue about their appearance, people tend to not see it. So if someone, for example, is balding and they end up going to do hair transplant, this is not body dysmorphic disorder, because they're trying to they're fixing an issue that they see. People can also see that they're balding, and they're only doing it specifically for that one reason once. Same thing with something, let's say they're doing their nose, if they're going to do rhinoplasty of
Which is
fixing
very
it,
common.
which is very common. But
Yes.
if they're doing it once because they're unhappy with the way they look, that's still not considered body dysmorphic disorder. What we're seeing is somebody that keeps fixing that same aspect, and a lot of the times they think doing surgery is a solution, but that tends to make
That's
it
right.
worse. They make it worse because they think, oh, he didn't do it correctly. Let me try another doctor that fixes it another way. Let me try another person that can do it this way.
Yes.
And that tends to see where this line, it's a very clear one when you see how obsessive it becomes. So it becomes a very, very clear at that point when those aspects are overcoming the person's thought patterns.
Yes, and I think you mentioned something very important. When it comes to BDD, the person suffering from it will never find perfection. They're going to keep looking for it, keep going back to surgeries and restoring to other ways, of course, to fix their appearance, regardless if it does look good or not. So how common is BDD now? Is it more common than it was before? Because I know that social media, fashion, and a lot of industries do play a big role in this issue.
Yeah. It's way more common than it is when we used to see before. So even the problem is when you come to even look at research and that, it's very not clear, because people that have BDD don't end up going and saying we have BDD.
Right.
So it's very hard to find them and conduct research on them. But when you still see this prevalence of increasing of conditions with BDD, and this is mostly due to social media, and it's because we have this culture of selfies, basically.
Yes.
Everybody's taking selfies.
Definitely.
And you have these different apps that do different filters. And these filters have gotten to a point where they do almost surgical procedures. They show you how your lips would look fuller, how your cheeks would look fuller, how your waist would look slimmer. You can put yourself in a complete different look, even though you didn't do any procedures. It's just a filter.
Right.
And this is very damaging to a person's image of what is considered beautiful in the industry, and what people and how they compare themselves to that. And you tend to see also that it's a big aspect of where you will see people that are like prior to the age of 18 very easily influenced by that, because they're very easily impressed or following influencers, for example, online. And you find these influencers, either they have done surgeries or they are using filters, and they're talking about, for example, saying how this product that I bought made my skin
Drink
smoother.
more water, have your vitamins.
Yeah, and they think, let me do it, or let me, but then at the same time, they don't achieve that. So how do I get it? And they end up thinking, oh, I'm not pretty, I'm ugly, I need to do surgery. And this is a big aspect of it, is because we are so exposed to the social media now, and there's a whole campaign regarding how one should look. And even I think if you go abroad, you'll see there's always the statement, is your body beach ready?
That's right.
And
it's very common right before summer.
They ask that.
We get this anxiety, are we beach ready?
Yeah.
And I can understand where
means.
this adds to the issue. Doctor, I think back in our day, our issues were more focused on magazine covers and models in magazines. Now, today, it's about social media, and it's right in our hands, which is even more dangerous. So back then, when we were teenagers, would look at the models and be like, how do they look like this? Why do I not look like this? And we would think that we have an issue. There's an issue within us. But what are other factors contributing to BDD in this issue other than social media today? Yeah,
so a big aspect of it, I would say up to 50% is genetic. And what I mean by that is either you have somebody in the family that has BDD, or you would have someone that's very close to BDD. And what is one of the closest conditions to BDD is obsessive compulsive disorder. And the reason for that is, if you look into the traits of BDD, is obsessive compulsive disorder, somebody has an obsessive thought. And because of that obsessive thought, they end up doing a compulsion. For example, you feel that your hands are dirty, and because your hands are dirty, you end up washing them multiple times.
That's right.
And somebody with BDD, they think, for example, their nose is not perfect, and they end up doing surgeries multiple times, or they end up doing their makeup multiple times, or they end up trying to hide their nose multiple times.
Spending hours in front of the mirror.
So because it's a very common representation of OCD, so if somebody in the family has OCD, somebody in the family has anxieties, and because a person with BDD tend to have also anxiety about the way they look, is this person seeing me how I see them, how I see myself? Do they think I'm pretty? Am I looking like, especially when they do surgery, do I look fake? did I do it properly? And they end up getting
Exactly.
anxious. So this is also common. If you have somebody in your family that has any predisposition to psychiatric conditions, that plays 50%. And then we have the other 50%, which is environmental. Part of it is social media. But then a big part is childhood. Were you
Right.
teased? Were you bullied about your looks? Did somebody say something mean as in terms? And that's very common. We tend to see, until this day, you get to see children commenting on the color of people's skin,
Yes.
the size of certain body parts. And people tend to feel insecure about that, growing up with it. And in order when they grow up to start feeling better, they can't help but try to adjust these. So that also plays
That's
a big
right.
factor.
Stays in their mind since they're kids,
Yeah.
especially in school. If you're a bit taller, shorter, bigger, or smaller,
Yeah.
that could create an issue when it comes to bullying. But how do we encourage someone with BDD to actually go and seek help? Because a lot of them don't know that they actually have an issue. They think
Sure.
what they're experiencing is completely normal.
Sure. I think this is kind of going back to how do we actually even approach them? Because a person that has BDD doesn't think they have a problem. And if you end up going to them and saying, hey, I think you need to go seek help. So let's say it's someone that didn't even seek any kind of surgical procedures. They're just
Yes.
someone that's concerned about the way they look. So if you tell them, hey, I need you to go see someone, they might now take it offensively, thinking that you think their unattractiveness is a mental condition.
Okay.
Or the other way around, them trying to help themselves is a mental condition. So it's important to make it clear that the reason you're telling them to seek help is because of this obsessive need that this person is doing. So for example, you bringing it up that, for example, you are spending so long trying to pick out an outfit. You are
Yes.
spending hours doing your makeup. You're spending hours at the barber trying to fix your hair, trying to fix your beard. You're dyeing you're changing your features. You're spending so much time on that, and that is something that we need to bring up with them so they're aware that it's a problem. Because for
Right.
them, it's cosmetic. It looks good. It's
course.
like just putting a nice outfit out or doing standard makeup, but they don't see the excessiveness or the impulse, the intrusiveness of these
Yes.
behaviors. So it's important that you bring it up in a very safe place and never speak to them in front of other people.
That's right.
Because a big aspect of it is a lot of the time they're insecure about the way they look, and if you bring it up in front of people, they start getting defensive.
Exactly.
So talk to them alone, explain to them why it's a concern for you. And of course, as I always say with any condition, always if you're someone that has it or know someone that has it, offer to go with them. It's okay to tell them, I'll come with you and we'll talk about what potentially could be an issue.
Okay.
And when they see that, they're more likely to go and seek help.
So just try to make it as comfortable as possible for the person dealing with BDD.
Sure.
So can we recover from BDD? Is that a thing, or is it an issue that we're going to have to be fighting all our lives?
Yeah. So most of the time we can recover from it, but it needs a lot of work and it needs a lot of therapy. And when we deal with BDD, a lot of it is dealing with therapy and dealing with changing the way you perceive yourself. Because a lot of it is self-worth and why you feel you need to change certain factors. And as I said, changing them due to one aspect and just, for example, as I said, hair transplant, this is not something that's problematic.
Yes.
But when it becomes excessive, this is when we need to say, why are you focused on it so much? And why do you feel trying to get this perfectionism aspect of you? So a big part of it, it's possible to recover, but it needs a lot of therapy to help you overcome
Yes.
the way you perceive yourself, your self-worth, your self-image, and your confidence. And know that a big part of it is it's not the way you look.
Right.
And a big part of it is how you perceive yourself. Because the issue with body dysmorphic disorder, it's not a body issue. It's a perception. And that's the problem. How you perceive yourself is the problem. You can be the most prettiest person in the world and feel unattractive, or the other way around. You might not be the most attractive person, but feel confident, and
Super
that
confident.
will make you even feel more attractive to people, and people will see you as more attractive. And it's all about perception. And I think this is the problem with body dysmorphic disorder, is the perception is sometimes skewed.
That's right. It's all we can say in their thoughts and the way they're perceiving themselves. I think you put it in the best way possible. So you talked about therapy, but are there other types of treatments? So I know with depression, maybe anxiety, there's medication a patient
Yeah.
can be put on. Does that work for BDD too?
Yeah, we tend to also go with something known as SSRIs, or in the common term, antidepressants, and they help with the person in dealing with the anxiety that comes with the condition, with the depression that might come with the condition, but also with the intrusive, obsessive thoughts that come. So it's similar to that, treating the OCD aspect of it, is that will also reduce these parts. So
Yes.
sometimes the medication plays a big role depending on how severe the anxiety or the intrusive thoughts are. And sometimes therapy plays a big part. But specifically when we come to BDD, I think it's one of the conditions where both of them at the same time, I think it plays a 50-50% in terms of overcoming or treating the condition.
Great. So it really does go hand in hand. It
Yeah.
depends on the actual case. Do you have any final tips or advice, even for parents that have children closer to the age where they can have this issue?
Yeah, I think one of the best ways to stop it from happening is the early intervention and catching this before it happens. I think is the role of parents to set up proper kind of role models of what is considered pretty, what's considered normal, what's considered beautiful. And we have to understand that there is no standardized way. We don't all have to look a certain way. Uniqueness plays a big part of how somebody is beautiful, and imperfection tends to what makes somebody beautiful. And this is what we need to focus on. We don't all need to look alike.
Yes.
And parents need to focus on that and focus on having their children to see if they're trying to imitate certain people they see on the internet or on social medias, is to be aware of it early on and make them understand that this won't make them feel better about themselves, and they should start appreciating who they are and working on themselves and liking who they are as a person. And this is basically how we can prevent a lot of these conditions, is by parents playing a big role in the mental health of their children. And if we're talking about if somebody already has the condition or is older, I would say it's important for them to go seek help. As I've been saying multiple times, there's nothing wrong with going to talk to a psychiatrist or a psychologist. Nothing bad will come out of it. They either confirm the diagnosis and tell you there's something that they can help you with, or they'll just tell you there's nothing wrong, and you're fine, and you can live your life the best way you want it and without any worries. So for me, if you have children, be there for them, advise them, support them, and play as a role model. Don't say things and you're acting out of character and they see you doing the things that you don't want them to do.
Exactly.
So support the image that you want to represent. And if you're somebody that's older that think they might have the condition or know someone that might have the condition, have them seek help. And as I said, nothing bad will come out of it. The worst case is they're confirming something that you might already have, and they will help you. That's the worst case out of it.
Exactly, because doctor, I know a lot of these diseases can have you go to a really bad stage later on in life. So to your viewers, it's always important, as Dr. Abdullah said, to actually go see a doctor. They won't lose anything.
They won't.
Exactly.
Nothing.
Doctor, thank you so much for being with us this evening.
Thank you.
Thanks. Dear viewers, we had with us the Doctor of Psychiatry, Dr. Abdullah Habib, Director of Clinical Neuropsychology, Mind Well. And up next is a report of food system awareness. Stay tuned for that.